Welcome to Pharmacy in Focus, where I will be having pocket-sized conversations on current topics and interests relating to pharmacy and the wider health sector. My name is Sharina Basan, bringing you Pharmacy in Focus on behalf of the Pharmaceutical Society of New Zealand. Welcome to episode 9 of Pharmacy in Focus. Today I am joined by Vikki Chan. Vicky graduated in 2004 from the Guinea Pig class of the School of Pharmacy at Auckland University. Vicky is a community pharmacist and co-owns Unichem Pakuranga Pharmacy. She is passionate about pioneering and driving clinical services at a community pharmacy setting. Vicky strives to collaborate widely across the health and NGO sector. She has an equity-based approach to supporting the most vulnerable people within not only her local community, but also far afield. Welcome, Vicky.
Hi, guys. Thanks for having me.
Now, can you just tell me a little bit more about yourself? So who is Vicky Chan?
Well, Vicky Chan. Well, obviously, I'm a passionate community pharmacist. I'm a migrant myself. So I moved to New Zealand when I was 9 from Hong Kong. Now pretty much a Kiwi now. So after graduating from University of Auckland, I did my internship, become registered, and back then, it was a little bit easier to do that cross qualification in the UK. So I spent a bit of time over in the UK being a pharmacist as well, before returning back again to Auckland, and become an early career pharmacist. I love fashion, so during that, first 10 years of my, in my early 20s, I also was quite involved in the fashion industry as well as, managing a couple of community pharmacies. But yeah, and then, you get married, have kids, you sort of have to prioritize. And so I decided, I should sort of refocus my energy into one or two things. So, family and my pharmacy career. And here I am today.
Thank you, Vicky. So you chose pharmacy over fashion.
Well, I think fashion was always a hobby. So it's okay. I can spend money buying clothes and things like that. When if I do well in pharmacy, I get it. So but I guess that fashion part was to balance a lot of my creative cravings and just connecting with really artistic and creative people, which sometimes in pharmacy we operate so systematically. It's black and white, it's all about accuracy and all that. So I think that was just an outlet for me to be a bit crazier or a bit more creative.
Right. Yep, the creative outlet that you needed.
Yes.
Now, coming back to pharmacy, I know you've been involved in delivering a number of different clinical services within specific ethnic communities. Now, how did this first come about?
I guess I think being a migrant myself, you sort of experience that firsthand as well. Your parents may not have English as a first language. So, sometimes navigating new life and a health system can be challenging. So it's I think when we're young, we're always helping out our aunties, uncles, or the wider community, trying to navigate those systems anyway. And when you're in the profession, it's just natural that you become sort of more of a advocate, for these populations. I guess professionally, it all started about 4 or 5 years ago when we have a pilot sort of project with counties Manukau Health, in terms of providing maybe a more flexible model in vaccinating our migrant communities, in terms of flu vaccination. I think back in sort of 2009 and 2020, like, you know, outreach wasn't such a common concept. So we're thinking, like, you know, for a lot of people, it could be more of a community settings, like, you know, when they're having meetings with friends, like, you know, within an organizations, or language could be a barrier, or transportation, because, you know, a lot of these elderlies or migrants, like, you know, the kids could be living overseas or they'll be working. So, you know, so sometimes a mix engaging and sort of attending, like, you know, to a GP sort of appointments become an obstacle. So we thought, oh, with a particularly not like so great sort of flu vaccination rate over the 65 years old, what can we do? Like, you know, what can we change? Or, you know, from a pharmacist sort of perspective, can we do something different? And that's, like, you know, when that first pilot project came out, and yeah, and then it's gone strength from there, especially with, you know, COVID, you know, evolving as well.
So you've talked about having a bit more of a flexible model, and in effect, instead of people coming to you, so coming to you, your pharmacy, for you to go out into the community. Is that where the Community Flu Fighters Initiative came from? Is that the trial that you're referring to?
It was like, there was actually a research done, like by one of our I think population health system, like, you know, student, like at the time at counties, within the population health departments at counties as well, like, you know, sort of investigating, like, you know, what are some of the barriers, and a lot of the results sort of came out, sort of shows that, you know, yes, it is the language, it is the access, and it is transport, and a lot of the time it's the setting, because we were measuring, like, you know, also why the uptake was so low in terms of flu vaccination at the time, like, you know, and many of them, like, were mentioning, like, you know, how they have never been told before that it was a free service, or, you know, and some of these elderly simply have never enrolled, like, you know, with a GP practice, being maybe slightly newly migrants, like, you know, when they come into the country after the kids has settled as migrants themselves. So, you know, a lot of that has come from those study to show that, oh, something different could be done to address those equity issues.
And where did you go? What community environments were you providing this? Well, I should probably first ask you what the Flu Fighters service and initiative was.
Well, so that very first year, it was a lot of learning, because, like, you know, obviously, like, we have to engage with quite a number of new sort of NGOs and organizations. So often with a language that, you know, obviously, like, I can speak some languages, but not all languages. So we have an amazing team that have got those different language skills. So we were visiting, you know, a few different Buddhist temples, which I could sort of use my Cantonese and Mandarin language. But we were also engaging with a lot of our Sikh and Punjabi and Indian communities. As you know, like, you know, India is you know, very multicultural and multilingual, you know, country. So, you know, it is our Hindis, Punjabis, and, like, you know, and other sort of dialects as well that we were serving. So that, and, you know, we were engaging with our Cambodian temples as well, like, through our different counterparts. So it was really a big sort of collaborative work. It's a great sort of team collaborative sort of efforts of sort of linking all the community leaders, and through them promoting, you know, a better way of flu vaccination uptake. But that first year we had to go around to a lot of organizations giving out talks, addressing why the importance of flu vaccinations are important each year, because we want to empower these elderlies, these individuals, right? Like, we just don't want to go in there and just vaccinate them and without understanding, okay, well, do you understand, like, the formulations of the flu vaccines get modified and, immunity get went off. Like, it's just about education and it's about empowerment. And able to address that sort of equity issues as well.
So the first year that this came about, what was the very first community that you provided these flu vaccinations to?
I think from memory, like it feels like that long ago, but it was mainly our Indian communities, and there were so many like wonderful sort of NGOs and community groups that are out there, which I didn't know at the time, but now, like, we've built up really strong like sort of relationships on various projects now. But there were so many groups of community like sort of out there, like that are looking after not just, I guess, elderly or senior citizens, but I guess just cultural groups or religious group, like and each groups, like they have different identities, like values and ethos to them. But ultimately, like I think our project was that not really just for the flu, because our vision was always about health outcomes. So after having like done the flu vaccinations, very often, like we will engage like sort of later on in the year about like it could be incontinence, it could be heart health or diabetes or nutritional or there was so much going on, like that I found out in our community, like for people that needs sort of that support.
So it wasn't just, what I'm hearing is it wasn't just going out and providing the flu vaccinations to those that weren't getting it. It was providing education and developing those relationships and going back and providing more education based on what these communities or portions of these communities might.
I think like the whole like like the goal of that pilot community flu fighter was really just to address flu vaccination, because based on quite a relatively low flu vaccination rate, like the couple of years prior. But then I think like when you start engaging like with all these community groups, you realize, okay, there's so much more that you can do from a pharmacy space. Like we would often talk about we sometimes like put in like blood pressure check prior to flu vaccinations, and then like there were so many things. So it's sort of slowly and naturally sort of evolved into more of a health engagement project, more like
And has this been well received?
It has been, and surprisingly, because I think a few years back then, like people and the community wasn't really so aware of pharmacies and pharmacists were being able to provide vaccinations. So when you first turn up to the first group, they were like, who's this like random like girl that put on her white coat and come out? Like they didn't really quite understand. I guess like maybe perhaps from not being really exposed to the existing health system as well. Like I think back then not a lot of people realized pharmacists could actually provide vaccinations, right? So so it took time to build on that trust as well. But I think it really helped because we've got those community leaders that were there to lead and connect us with these members. And so we built up trust, and it was always about a long-term relationship. We didn't want to go in there and just be doing that once a year like flu vaccination. The vision was always to build on a relationship that we will come back years and years and and we have seen it, last year with COVID vaccination, we have really facilitated a lot of clinics and outreach just because we had those existing relationships that we built a few years ago.
And you mentioned that your first clinic was with the Indian community, or wider Indian community, but you also mentioned that you've provided this initiative or this project to other communities as well. So can you expand on that a little bit?
Yeah, so we obviously, with my Asian background, so it was Chinese community, with different religious group, the Sikh, our Egyptian community as well, because we had a great relationship because we used to have an Egyptian clinical pharmacist that worked with us, and and I think there is always that common factor that help us engage. There's always that need for better health outcomes. So, our Egyptian communities have been really supportive of our work as well. Our Muslim communities, our pharmacy is situated on a street which we have a mosque on the left-hand side and a church on the right-hand side. So, we engage with our closest neighbors, and from one mosque, we were serving to another mosque, and from one church, we were connecting to other churches as well, but also we have our Samoan communities in the south Auckland area as well. So it wasn't just limited to what I could speak. I think the common language obviously is literally that language, but I think a common language is we all want to be healthy, and we all want a better outcome for yourself and our families, and that's where we set out to do, and it's just gradually expand to this massive network that we have been serving, and it's just quite interesting. And our Koreans communities, they have been really supportive as well, and it helps when you have an amazing team that speaks all these languages, but sort of share the same values and ethos that what this is about. And I think it's interesting because, a lot of the time when we run a clinic, it's not always about the Korean language, and sometimes it's about, the Korean communities, actually have built up a trust with one of our particular vaccinating pharmacists, and they always want to see Chris because we can communicate simple messages through the way we speak, our body language, but the support, so they trust us. So it is a really beautiful thing because that relationship has built up over the last 4 or 5 years, and they still come years and after years, coming back for the flu, and now we recognize them for obviously the flu vaccinations, COVID vaccinations, but other sort of health needs as well. So it has been a wonderful journey.
Wow, very inspiring, and hopefully a model that is going to be taking off in other regions if it hasn't already. One of the things we talked about recently was how, when you were first approached about this idea of this Community Flu Fighters initiative or project, that there wasn't any funding. Tell me a little bit about your journey from the conversations of no funding to then providing this first trial clinic.
It's obviously, I think this lack of funding or will resonate with a lot with our colleagues, because funding is always tight, and I guess sometimes there's only so much that comes out from that same pool. So when counties Manukau, particularly from our Asian health departments, we have Kitty Ko here, she's one of the main advocate for Asian health, come approach us and said just based on the findings and the low flu vaccination rate, do we want to do something? I'm always into something new and wanting to try out new ideas. You got to try out things in a sort of health setting, in order to make changes, but preferably with funding. But So we talk about all these ideas. Yes, like we want to do outreach, we want to set up a proper like cold chain, but also like, you have to consider like, when you go out to do this outreach, someone else has to do your sort of basic dispensary work. So, it is about like, having and setting up a whole different team to be able to go out to do this work. And it's not always just, a 1 hour, 2 hours sort of work. Like, when you also have to put in a presentation, a seminar, and, Q&A sessions in it. So, you have to quantify all those things. So, but there wasn't any funding available. So, I think, the passion was there, the idea was there. Everyone wants to make it happen, but there's no money involved. So, so we put it off for about a year. Like, we said, okay, well, if there's no funding, we just we just have a look and, sit on it, The next year, of course, like, we initiate that talk again and, with still no funding. I was like, I don't want a lot, I just want a fair like funding to set us up with a proper like sort of outreach cold chain gear. I'm happy to fund my staff, like, and still no funding, but we thought, okay, well, we have already done so much research and if it is for our migrant community and ethnic community, let's try something, okay? And we're just gonna trial it and see how it goes. No promise, like, I may not be able to do all these 30 or 40 groups of people, it's quite a significant sort of financial outtake. Especially when we are talking about for a lot of these outreach, you don't have a guaranteed number sometimes, you may turn up like, as much as we want to register, like, at least 20 sort of members, sometimes it doesn't happen, so we thought, okay, well, it's just, trial it anyway. And surprisingly, like, we received such amazing sort of response that, it really surprises me. Like, when we turn up to one Sikh temple that first year, we took with us like, I think 90 vaccine. I thought to myself, surely I'll be happy if we do like 20. Given that like it is the first year, people don't usually engage that way, and who knows how it's gonna happen, And that particular clinic, I really remember so vividly. Like, it was, I think, 99 vaccines that we took with us to that temple. We completely like, vaccinated all of our vaccines in 2 hours because I think it is the trust that they place in their community leaders that was promoting, hey, this is the first time the team has come out and this is what we're doing. And the support that we got was tremendous and overwhelming. And it was a surprise. But behind the project, like, I think like people need to understand, like, we were trying to address I guess affordability, but also to convince people that we're really helping to engage and improve equity. And so, a lot of the time, like we were providing, and up till now at this point, we are pretty much providing like, the vaccinations for those who are not eligible for a free one at just almost at cost price. So it was purely not really a profit-making exercise for us. It was almost a bit of a social experiment for us. So it was still very interesting, like, and for those who didn't quite get our concept and didn't really understand how this pilot works, it all started like that. And we're still committed to that model because we want to continue and sustain that long-term relationship.
Now it's really interesting to hear the story and the journey that you've gone through over the last few years. Now, some people that are listening to this episode might question the idea of providing services without any funding and looking at the cost to your business in doing so. So what was your decision-making process after a year or 2 years of having these conversations and finally deciding, you know what, let's just give it a go anyway?
A lot of people that call me crazy. Like even now these days, my team like does things a little bit crazy, and like still have the drive and passion. But I think once you're in the field, like when you see the inequity and like the barriers and the improvement or changes that we as pharmacists were able to make, like it was really humbling. And I think like I got so much more out from just maybe the first year, like I think we did around like maybe 300 to 400 like flu vaccinations in that outreach model, which is totally new and unheard of, because I mean like there was always that workplace model out there, but it was a new concept. And then like there were other DHB that wants to look into a similar model, because I mean it is not something that's hard to do, and I really don't like feel at the time it was something that other people cannot sort of duplicate and be able to provide at other regions, because there will be groups and so many communities out there that will benefit from something like that. And so I think like that first year was totally experimental. And then once you have engaged more, you feel like you can actually, I mean like I guess being a co-owner, it gives me more flexibility in terms of making these decisions. And a lot of the time I have to sacrifice obviously the weekends, because that's where churches gather, or when people go for their prayers or do the meetings. So there was a lot of out of normal business hour work, or there were a lot of weekends. So basically I block out all my winter weekends anyway, like for mid March to end of May, mid June, like so those were not easy decisions sometimes. And for the first couple of years, I think there was a lot of out of comfort sort of zone decisions that you have to make. But and I'm very lucky, like I have amazing team, so I involve everybody, like and everyone takes turns too, like we'll take turns to go to different clinics and experience. And and it is a humbling experience, like for my team. So it wasn't just pharmacists being involved. We have our interns, we have our pharmacy technicians, and sometimes I take on my sort of retail team, like that have a specific language skills or religious sort of background, so we can cater for a particularly need for a group. But financially, like it's wasn't always a balanced decisions for the first couple of years. But I guess I don't know, like I felt I want to give, and sometimes they give back to me in many different ways, in terms of what the patients give back to me. And sometimes I still go to different areas of Auckland, and people will come up to me and say, hey, do you remember me? You came to Bhatia Samaj, particular like groves. And because I would go there years after years, or seasons after seasons. So and I think sometimes you can't always quantify it in a financial way. And with come COVID time, I think it has given us more than what we thought we have given, like in a surprising way. So so I felt like we have, our team has really contributed it in a way that was that have helped, like cement what pharmacists and pharmacies can do.
Definitely sounds that like the contribution of you and your team has had some real impact, like practical impact. You've been able to build relationships. You've probably been able to learn more about different cultures and peoples and ethnicities and any particular issues or conditions that that they might be faced with that you may not have known before.
And it's quite interesting. It has been tricky because, like, in 2020, when we first had the COVID real lockdown, there was a lot of barriers of and getting flu vaccinations because of the lockdown. So, we had to really improvise a lot. And, when you think about each locality or organizations that have their own sort of venue and sort of point of meeting, like, it's almost like running 50 different clinic with 50 different settings or needs. So you really have to think outside the square so much because of the social distancing. Back then, like, everyone was really paranoid with obviously the social distancing and the protocol and of the whole COVID sort of guideline. So, I think 2020 like really put us into that. Okay, how do we solve every single clinic setting sort of set up, or how do we make it safe, and how can we make it actually doable? So that year, I think, like, was particularly challenging for that flu vaccination project, and we have to change it from time to time. There were so many barriers, basically, like, but it really makes you grow because because there was that many challenges, on top of what we have to manage on site already.
Indeed. One of the other things that you mentioned when we've spoken before is that you're also helping migrants, people that may not have NHIs. You mentioned earlier people that have language and literacy barriers. And I think you also mentioned some that don't engage with the wider community. How do you think you've provided for these people? What have you been doing to help these migrant communities?
And again, like, I'm sure, like, a lot of our colleagues have been doing the same, like, since the COVID rollout, like, especially for those who have been involved in COVID vaccination clinic, that, people turn out without NHI because they hold a work visas, or we sometimes, like, going to some outreach clinics, like, there will be overstayers, and so they feel quite intimidated, like, having to come forth to engage and get COVID vaccination, right? So, I'm sure, like, a lot of other pharmacies colleagues will have done the same. But we set out sort of a mission, like, when we first provided that, we're not gonna turn people away just because we have a long queue waiting, but, we want to communicate in a meaningful way that, like, that we will ensure that, despite, the workload, that we will, help them set up and, apply for an NHI. And from there, explain the whole process. But, and remember, the root problem is not just not having an NHI and not being able to get COVID vaccinations, but, most of them don't even know how to do the scanning when, we have to have the health app, or they have never enrolled with a GP because they think they're not never gonna be sick. It's those health concepts, right? So, so our team have sort of set out this mission that, we're gonna show everybody who doesn't know how to engage and encourage them, like, where to go to enroll, pointing them out where to go. So, in preparation for, I guess, in COVID some way, that, just because you have never been sick before, like, maybe you should still enroll with a GP, because, especially with, a lot of enrollment and full capacity, and, we don't want them to have to deal with these things last minute. So, and, with overstayers as well, they feel really intimidated, like, fear for them to come forward to have these health service. So how do we sort of be able to provide sort of service in a trusted settings. And I think, you know, at that really sort of make it more important that we do this outreach work, because, you know, because they go to the temples, they feel safe there, because, you know, they have a leader that they can maybe go to and be able to have those sort of private and confidential sort of conversations, and then we help facilitate some of these services. But, you know, I think it's not just, you know, religious group or migrants, but, you know, we've done a lot of work with gangs as well, you know, in terms of COVID vaccination. So I think, you know, the common theme there is, you know, how can we do our work for these people in a trusted, but I guess in a safe way, an environment that they feel comfortable, that they feel trusted, and they feel not judged, you know, because often you don't want to ask too much because you don't know, or okay, just get the vaccines, you know, and but what about all this misinformation, you know, or they're not given a vaccinations card, so they don't even know they need to come back for the second one at what time, you know. I don't want to be there just be vaccinating and not addressing all these things, because it's not just one person I'm seeing that's experiencing these barriers. But I just felt like, you know, it's not an isolated case, but there are so many of them out there. So it's sort of become, sort of like a mission for the team to sort of try to facilitate as many as possible, but try to like use a very limited time. Like, you know, I have to say, like, you know, we did, you know, we were so swamped with work. We can't spend 10 minutes with everyone, but, you know, in whatever sort of time and space that we have, we put as much out as possible.
So am I right in hearing that you don't go out for the purpose of just providing a vaccination, because a vaccination is considered good for you know, in this instance, maybe, you know, people over 65 who might have a low vaccination rate. But what you're doing is trying to address the wider needs of that population as well. So yes, they might be coming in for this vaccination and you can educate them around that, but you are addressing any wider health needs, or, as you say, misinformation, and educating. So it's a more comprehensive, holistic approach.
Oh, for sure. And like, you know, and a lot of this engagement like really highlight what I think pharmacists can do in general, because, you know, we're in that sort of middle ground, like, which we're the perfect sort of access point for patients, but then we also, like, you know, communicate and have that sort of potential to collaborate so much with other health professions, that I really felt like, you know, we're in that positions that we can potentially do a lot for our patients. And that's why, you know, I really want to invite, you know, all our pharmacist colleagues, everyone that's in this sort of pharmacy space, to think more, you know, when you engage with your patient. And I'm sure, like, you know, I think most of our wonderful pharmacists do, like, you know, we're just sort of, you know, limited with time and resource sometimes, but, you know, where possible, like, you know, and I think, like, you know, it's a more comprehensive things that we can do and provide, for sure.
Indeed. Hey, Vicky, you mentioned being involved in gang outreach a few minutes ago as well. Can you tell me a little bit about that and how that came about?
I mean, at first started like sort of mid-August last year, when we had a great collaboration like with Dr. Jensen from National Coalition Force. Like, you know, he's such a highly regarded doctor in the Maori world. Like, so, you know, it was such a privilege to be able to work with well, really, like, you know, to be able to be involved in sort of a Maori and Marae setting clinic. So we were so thrilled when we were asked, like, do you have time and can we work together? And so, it's all sort of evolved from that when we organized some Marae sort of COVID vaccination clinic. But, it was very kaupapa led, like, it was obviously like, very Maori sort of centered approach, which has really was a really eye-opening sort of experience for our team as well, which because we never had a lot of those opportunities. So it was a great opportunity for us to really learn and in that space. And from there, like we continue to work on a lot of projects. And eventually we thought, like, and we teamed up with Mount Wellington outreach vaccination team. We thought, while people are waiting for the 15 minutes of post, like, COVID vaccination time, how can we use those time better? And that's we thought, why don't we bring, because at that time we were really engaging with a lot of our South Auckland sort of communities on the streets and things like that. So we thought, why can't we try doing Hep C and test and screening, for those to, find a more meaningful way to that 15 minutes. So from there, it evolved into, like, some gang sort of settings, COVID clinic, which we obviously bring COVID vaccinations to the gang file now, as well as the Hep C screening and testing as well. And and then so, it all started from there. And just before Christmas, we had a Kaitaia sort of convoy that we headed up to Kaitaia, like, for a long weekend. And we did over, like, 200 COVID vaccinations and over, like, just under about 100, like, hepatitis C screening for our gang communities up at Kaitaia, which we identify a couple of Hep C positives as well, which, so, different needs, obviously, and a very different sort of approach to our more far north community, where sometimes access and equity, again, is a bit of an issue. So, so, like, that was our sort of gang experience. I have to say it was very interesting. You sort of have to set aside some of your personal bias when you are providing health, and holding conversations in a very different way that will reach those community and families as well. So it's been a steep learning curve for our team. Very interesting learning. Yeah.
Fantastic. And another wonderful initiative too.
Yeah, and it really sort of proved that again, like, outreach, the model itself, which, from outcome, like, really 4 or 5 years ago when outreach was not a thing, to now, that mobile model and the mobile clinic, I can only see, this mobile health sort of initiative be expanding more to other health services and screening and testing or point of care eventually as well.
Indeed. Now, Vicky, you have done a lot in the past few years when it comes to these outreach clinics. And just for the record, I know we talked about how there was no funding initially. Have you been funded in recent years?
Still, like, a lot of these, obviously, like, we have great clinical contract now in place, like, for our COVID vaccinations, which have been great and so wonderful to see that, pharmacies and pharmacists are utilized. Like, I just wish that, some of these services were funded earlier. So come COVID time, we were more prepared and we were more set up. But nonetheless, I think, like, we have evolved and been given the opportunity to show that we can as pharmacists and pharmacists. I wish that, you know, some of these clinical services are more given more sort of widened access, so everyone can be more involved, and it can be more accessible for all pharmacies, and not having to jump through as many sort of hoops or you know, application processes and things like that. Our community flu fighter projects are still not funded, although, like, you know, counties have acknowledged sort of our efforts and the outcomes, you know, ongoing. And, you know, I'm very proud of a project like that, and the support of the community, you know, groups that, you know, have given us, like, you know, throughout the years. But I guess it speaks itself that, like, you know, with our COVID vaccinations work, I guess, you know, in some way have paid for what we haven't been paid. And yeah, but I just wish, you know, DHBs and, you know, ministry would look deeper into what great pharmacies work have been done, and addressing contracting and commissioning, like, you know, more meaningful contracts of pharmacies that are set out to provide clinical services. You know, and in my bio, like, you know, I think thank you for introducing me as being passionate about clinical services, because I really felt that we are in this space that we have to evolve as pharmacists and pharmacies, that we should be providing more clinical services, and, you know, we have that, you know, obviously ability to do so, proven with, you know, all these different initiatives. Like, you know, you look at INR, CPAM, you know, clozapine, you know, red tests, you know, all sort of vaccinations. You know, why are we still not having, you know, funded whooping cough vaccinations in pharmacy space, when you see pregnant lady finding it very hard to access GPs, you know, during this COVID time? You know, we should really look at all these needs and address it, like, you know, quickly. You know, how many more years do we need to wait, you know, for these fundings to come through? So I think it's just a no-brainer thing that, you know, pharmacies should be all given, like, you know, more resource. You know, we're all burnt out, right? You know, with their changes every week. You know, how can we keep up? But we you know, if we're given resources and funding, we can do more, and we can do more better. And ultimately, I think, like, you know, it's all about equity and accessibility and health outcomes. And, you know, I think we're really in this perfect place now, because we are all so equipped, and we improvise. We are all great problem solvers. You know, who better to do it than pharmacists?
Indeed, we're out in the community already, right?
Yeah.
Yeah, that's exactly right. Just based on what you have been saying, where do you want to see pharmacy in 10 years?
You know, when you look at, like, the past 10 years, who knew that, like, you know, from that reclassification of you know, flu vaccines would lead to all these vaccinations, like, you know, come 10 years later. So, and, you know, who knew that we could be prescribing and, you know, and doing, you know, a lot of the UTIs prescribing, and, you know, having pharmacists prescribers. You know, for me, I think, like, you know, my vision would be for pharmacists to have a more collaborative, like, an integrative, like, sort of approach in the health system. You know, the sitting in PHO and GP practices or even like, you know, from a community pharmacy setting, how can we work better and integrate with GPs, nurse prescriber? You know, I think, you know, you can see, you know, the contribution of nurse prescriber and pharmacist prescriber and PHO, but how can we utilize, you know, maybe our skill sets a little bit better in community pharmacies as well. So I think, you know, in the next 5 to 10 years, it will be having more maybe point of care screening and testing in community pharmacies, definitely clinical roles, you know, in the community settings, and, you know, and just working with PHO and other sort of primary health colleagues as well, because you can only see like the pressure that's being put on primary health care are getting bigger and bigger. You know, our GPs sort of numbers will be declining, you know, with retirements and, you know, resources as well. You know, our health system needs pharmacists, and I can only see us playing an even greater role, you know, in the next few years.
Wonderful. Thank you very much, Vicky. So I mean, you've touched on a lot of points here. One is the immense pressure that's in primary healthcare right now across the board. The reducing number of GPs or the increasing number that will be retiring in the coming years, and we know that they are struggling as well. And it's really interesting how you were looking back the last 10 years, and you're right. You know, that we are doing more clinical roles. We are doing point of care. We are prescribing, you know, oral contraceptives and you know, UTI treatment. Yeah, there's a lot that's happening in the space. We are vaccinating, and it's not just flu vaccines now, that is being widened. You know, doing rats tests, etc. Now, yeah, there's yourself, and I'm sure there'll be other pharmacies around the country as well that are going out into the communities and providing different types of outreach clinics, whatever that may look like. So, you know, so things are certainly changing within pharmacy, and from what you're saying is to just carry that on and ensure that we can integrate better into the primary health setting. So thank you very much for that insight and your point of view on that as well. Thank you for speaking to me about the different outreach clinics that you've been involved in. I think it's fascinating, and the fact that it's just growing and growing and growing. I mean, it's probably going to get to the point where you're not going to be in your pharmacy very much, because it's just going to be.
I know, it almost felt like that for the last 18 months, like, you know, when are we stopping outreach clinics? And, you know, so it will be interesting come maybe potentially, you know, the second booster as well. So, but thank you so much, Serena, like, you know, for letting me share my experience and my team's experiences, like, with everybody, and hopefully, like, you know, people that are listening will can resonate and maybe take the same approach to your own practice as well, because I think everyone can do it.
Indeed. Thank you very much, Vicky. Enjoy the rest of your day. Thanks for speaking to me, and we'll see you soon.
Thank you.